We, the researchers at IMR, have developed an innovation and we would like to share with all of you all today, wherein the presentation today would be optimizing COVID-19 response in Malaysia using the innovation that we have developed called COVID-19 Situational Level Metrics, which is a web application system. As we know, the COVID-19 pandemic had a significant global burden since its first emergence in 2020. It has resulted in about 760 million infections and more than 7 million deaths globally as of April 2024. Now, what are the challenges that we commonly face when it comes to monitoring and managing the COVID-19 pandemic? Well, for a start, it's a novel disease wherein initially there were no baseline data. Case trends used to fluctuate with high uncertainties. In addition to that, it was important that there is a mechanism to determine the intensity of disease transmission and how well our health response can react to the disease transmission. And this would actually help in adjustment of control measures wherein there is an important need to actually strike a right balance between the level of control measures and livelihood. So therefore, having said this, that it is very important that there is a system available that can assist health authorities in gauging and managing the COVID-19 pandemic. For that, our innovation COVID-19 situational level metrics does fill in this gap. Now, the COVID-19 situational metrics was a matrix that was actually developed based on the guidance report by the World Health Organization titled Consideration for Implementing and Adjusting Public Health Social Measures in the Context of COVID-19, wherein through this report, it is suggested that the COVID-19 situational matrix is a matrix that should be developed by each country, wherein this matrix is a dynamic matrix that holds several important values in gauging and managing the COVID situation. More specifically, this matrix is a standardized approach that allows health authority to assess COVID-19 risk and response. It enables proper adequate risk assessment in terms of disease transmission and healthcare response capacity. Subsequently, it allows appropriate adjustments of COVID-19 response based on the provided assessed risk, and this would inform policymakers to make evidence-based decisions when it comes to instituting and implementing COVID-19 response measures. And all of this in a nutshell would allow effective monitoring and evaluation of the COVID-19 responses. Now, why is it there is a need to develop this particular innovation? Well, as a start, there is a need to identify the appropriate indicators and subsequently validate them. Okay, as these would be appropriate indicators to formulate the level of disease transmission and response capacity. Secondly, with validated disease transmission and response capacity levels, we can then put them together to produce daily Malaysia-specific COVID-19 situational level metrics and subsequently validate the daily COVID-19 situational level metrics, and finally use this validated daily COVID-19 situational level metrics to formulate a web application that is able to generate real-time daily values of the situational level metrics. Now, I'll be going through them one by one. With regards to indicator selection and validation for the CT and RC levels, CT levels refers to community transmission, whereas RT refers to health system response capacity. For our innovation, there were several indicators that we used to formulate the CT. They range from case incidence, hospitalization rate, mortality rate, as well as effective reproduction number. Similarly, for the response capacity, the indicators that were available were hospital bed capacity, COVID-19 ICU occupancy, case fatality rate, and adherence to public health social measures. These indicators were used in several combinations. Cutoffs were applied to each of these indicators based on the COVID-19 WHO cutoff levels, and each of these indicators were then aggregated and mean values for each of these indicators were used to get an overall level of the CT and RC. Now, subsequent to this, we validated each of these combination through a correlation analysis between the CT values and the RC values with the daily COVID-19 cases to identify which combination had actually produced the highest degree of correlation. And following this analysis, it was clear that indicator combination number 1, which basically is indicated in this blue area here, was the indicator combination that produced the highest correlation, that was 0.806 and 0.814 for the CT and the RC component respectively. Secondly, following this, it was important for us to then use these validated CT and RC levels to actually form the composite matrix, which is the situational level matrix. This diagram here denotes the situational level matrix, which is actually a composite variable that is made of the response capacity and the transmission level, wherein the response capacity is divided into 3 levels: adequate, moderate, and limited, while the transmission level is divided into no cases, cluster of cases, CT level 1 right up to 4. Now, by combining these two indicators, we are able to form the COVID-19 situation level matrix that ranges from level 0 to level 4, level 0 denoted by this area in green, which indicates no transmission, to level 4, which is uncontrolled epidemic. And each situational level will have guidance on the type of COVID-19 public health response measures that should be instituted. Now, following this, after being able to produce daily COVID-19 situation level metrics at the national level, these national situational level metrics measures were then validated in the following ways. First, we performed a correlation analysis where we took the daily situational level metrics values and we correlated them with COVID-19 cases. And we found a strong, significant, positive correlation between the developed situation level metrics and COVID-19 cases, as you can clearly see in this graph. Subsequently, we also validated the COVID-19 situational level metrics values by doing a trend analysis, wherein we observed how the daily situational level metrics responded to various COVID-19 trends. So, for example, you can see there is a situation where we have got a rapid increase in cases, where we see our COVID-19 situation level metrics is quick to step up from a lower level to a higher level when there is a rapid increase in cases. Subsequently, in addition, when there is a rapid decrease in cases, the COVID-19 situational level tends to be a bit more conservative before actually dropping down to a lower level. And we also see very conservative types of trends occurring when there's a gradual increase and a gradual decrease. This inevitably indicates that the situational level metrics responded in a timely manner as well as a conservative manner to the changes in the COVID-19 case trend. Moving on, once we were able to then validate the COVID-19 situational level metrics, it was then important that we developed a system or a web application that is able to run the COVID-19 or generate the COVID-19 situation level metrics at a real-time daily manner. So for that, the first thing what was done was actually developing the COVID-19 situation level web-based application. This was done using the R programming software with several packages, and this system then allowed us to generate real-time situation level metrics within an hour of data input. And furthermore, the interface is an interactive interface which is available on the application. To ensure that we have got daily situation level metrics being produced continuously without any interruption, we ensured that the data was available, or the server was available in a cloud base as well as with backup servers. Manual override function with open access data source was made available. We also enabled manual override in case of automation failure. So these measures were put in place to ensure continuous daily situation level metrics output generation. This is the COVID-19 situational level metrics web application system which we have developed. So upon logging into the system, users are immediately brought into the first interface, where in this interface shows several information. We have got the information on the situational level matrix level, which is denoted by this graph here, which is an interactive plot where it's presented in several colors. Each of these colors basically signifies the level of situation level matrix, which ranges from green being level 1, yellow level 2, orange level 3, and red being level 4. Also, the graph also presents daily COVID-19 cases, so users are able to appreciate how the changes in COVID-19 cases occur with respect to the situational level metrics. The interactive functions allow users to zoom in to specific dates as well as zoom out. In addition to this, users can also view the daily community level transmission along with the daily health system response capacity levels. And in the top corner of the graph or of the web application, we can see the most recent situational level along with the effective reproduction number, which has been integrated into the situational level metrics. Now, also users have the option to visualize the data in a tabular format, which can be downloadable in multiple types of format. So this is the situational level metrics web application system that we have developed. In summary, due to the various challenges in managing and monitoring the COVID-19 pandemic, our innovation, which is the situational level metrics, have assisted basically by developing a web-based application using the WHO guidance. This metrics is able to provide validated real-time daily COVID-19 situational level metrics value by estimating disease transmission and response capacity levels using suitable validated indicators. These levels, which are the situation level metrics, the disease transmission and the response capacity, actually are very important as they provide assessment to the real-time risk of COVID-19, they provide important evidence for adjustments of COVID-19 control measures, and they allow for monitoring and evaluation of the COVID-19 responses. The innovation that we have just presented today have also been published in a peer-reviewed journal known as the BMC Public Health, and these are the list of the project members that were involved in the development and formulation of the COVID-19 situational level metrics innovation. Thank you.